Hi, my name's Meah Robertson and I'm the naturopath behind Fem21. I'm just doing a little video today to talk a bit about endometriosis, and this is something that I see in my practice quite often, so I thought I'd do a video to explain a little bit more about it and I guess my experience with treating it and supporting women with endo and what the driving factors are behind it, and hopefully this gives you some information to help you on your journey. So first and foremost, endometriosis can be quite hard to diagnose, and it's most commonly diagnosed through a surgical procedure called a laparoscopy. Now, I know it might sound fairly invasive having surgery to diagnose endometriosis, but first and foremost, you can start with seeing a doctor or a naturopath that's familiar with women's hormonal health and get an idea if your symptoms are matching the picture associated with endometriosis. So some symptoms to look for if you suspect that you might have endo is firstly painful periods. And painful periods can be quite common, but with endometriosis, the pain associated with your periods and before your periods and also around ovulation can be quite debilitating. So basically, the process of endometriosis is where lesions form from cells traveling outside, endometrial cells traveling outside of the uterus and into the pelvic cavity. And they can lodge anywhere within the pelvic cavity, from the external wall of the uterus, in the fallopian tubes, on the ligament that holds the ovaries, on the bowel, on the bladder, within the pouch of Douglas, which is the space in between the external wall of the uterus, the pelvic cavity and the bladder. It's like a little pouch in there. So endo can form when we've got an imbalance hormonally that drives the growth of those cells outside of the uterus. So that can be as a result of retrograde menstruation, which is the traveling of those cells outside of the uterus, fueled by estrogen. And at ovulation, we have a surge in estrogen. The body then metabolizes that estrogen and clears it over the luteal phase prior to the next period starting. So if we're having issues with estrogen metabolism after ovulation, we can have much higher levels of estrogen swimming in the body. The body doesn't clear it effectively, and that estrogen then becomes an inflammatory and growth hormone for those lesions or those cells of endometriosis. This creates like an ulcer where it's lodged, and then it thickens, and that thickening and growing can cause inflammation and pain. And then when it's period time, that lesion bleeds like it would normally shed and bleed within the uterus at period time. But because that bleeding's happening outside of the uterus, it can cause quite a lot of pain. And depending on where those lesions are lodged as to how much pain you'll experience. So there's differing degrees of endo. It can, be a mild presentation up to a quite severe presentation. So from a hormonal perspective purely, we really want to ensure that your hormones are balanced with the good and bad estrogen and how your body is metabolizing that after ovulation. So I like the analogy of a bath. And so if we're quite estrogen dominant, we're producing a lot of estrogen, it's like we've got the taps on full bull in the bath. And so the bath fills up really quickly with a whole lot of estrogen. And then if we're not metabolizing that estrogen well, it's like that drain, that plug hole is quite small or might be blocked up with hair, I don't know, congestion, and then that means that the bath doesn't flow out very well, so that can overflow, it can be stagnant and sitting there for a long time, which then means that our body has a lot of this estrogen and poor estrogen metabolites. So we want a nice flow for estrogen through the body at ovulation and through our cycles. So we are clearing estrogen through the liver and the bowels and also through the kidneys. And if that drain pipe's quite congested, if we're not clearing that very quickly, then instead of good estrogen, flowing through, it turns kind of bad and toxic and quite potent because it's in the body for a lot longer time than it needs to be. And there's lots of different types of estrogen. So I kind of just break it down into good and bad estrogen. So that to simplify it, that bad estrogen is what will really fuel the growth of endometriosis. And so if you have a laparoscopy without treating and supporting your body's hormonal balance, then the likelihood of it growing back, the likelihood of you experiencing ongoing inflammation is quite high. So let's talk about other factors involved, because hormones aren't the only thing that drives the severity and progression of endometriosis. The other really important system is your immune system. And your immune system is, think of it as like the body surgeon. So ultimately your immune system should recognize that there's cells of endometriosis, there's lesions there, and that it's somewhere where it shouldn't be. So it should be, the body ideally would scan that area, say that that's something that's not right, and send in its Pac-Man, gobble up those cells of endometriosis and heal and switch off inflammation. So if the immune system's not functioning properly, whether it's because it's run down or it's lacking in resources or nutrients, or there's a viral load or an autoimmune process or something that's driving chronic inflammation, like even mold exposure, chemical exposure, then your immune system's not going to do that job well of cleaning up those cells of endometriosis. Another theory behind what drives endo and disruptions to the immune system is gram-negative bacteria translocating into the pelvic cavity and then driving an inflammatory process, which then means that the immune system doesn't work properly. To simplify things with the immune system, I like to break it up into kind of like 3 parts. So we've got the main part of our immune system, which is designed to protect us from invading pathogens and viruses, bacteria, that side of things. A big part of that is around the barriers of our body in terms of our gut and also our skin and mucosal membranes. Then we've got our autoimmune system, which is designed to clean, and it recognizes cells where they're lodged where they shouldn't be, tumor cells, rogue cells, old cells. And so that part of our immune system is designed to target our cells. And so it will clean up, and that's where that little saying of that part of our immune system's like a surgeon, laparoscopic surgery and cleaning up endometriosis. So if there's any autoimmune processes going on, then that can certainly disrupt the function of that part of the immune system. Then the third part of our immune system is inflammatory control. And inflammation's not a bad thing. The body needs inflammation to heal. So just like if there's tissue damage with spraining your ankle, we'll experience signs and symptoms of inflammation associated with that in order to heal the body, protect the body. So like if you sprain your ankle, you'll experience pain, redness, swelling in that area. So they're all normal inflammatory symptoms. But inflammation can go wrong where we don't get healing happening, and we can have a chronic inflammatory response going on. And this is often what occurs with endometriosis. And inflammation then leads to chronic pain within the pelvis and within the organs affected by endo, and that high level of pain, fluid retention or bloating in that area. And that's really, designed to put out the fire for inflammation. So that's really common to experience that swelling abdominally with chronic inflammation. And then redness, but we can't see that because that's all going on internally. But if your body is running inflamed systemically, you may notice joint pain, really like redness and irritation on the skin, really sensitive in terms of, foods and the environment and chemicals or alcohol, for example. So just trying to reduce total inflammation within the body. I use a combination of nutritional support, herbal support can really be helpful. The other thing environmentally that can contribute to endometriosis that's worth discussing is mold and chemicals. So ensuring that you're not in an environment where you're sleeping and breathing in mold, or working in an environment where there's like a mold problem. So if you smell it, certainly that can be a factor. If you can see it, you want to treat it. You can also get people to measure, mold spores, and if you have a sensitivity to that. So some people can be quite reactive to mold, so it's just something to keep in mind. Also, chemical exposure, like we're living in a sea of chemicals, so really being aware and minimizing as much as possible is important. So organic foods, drinking, filtered water, personal care products, going natural with like your makeup, your skincare, your hair care, deodorants, washing your clothes in, chemical free, natural, environmentally safe, products is really good. In terms of what you're cleaning your house with as well is really good. Swapping out like air fresheners for essential oils, and avoiding any chemical exposure through those means, because those chemicals can be really strong endocrine disruptors. Plastics as well, what you're drinking, your water out of. If you're heating food up, don't do it in plastic, do it in ceramic. Drink water out of stainless steel or glass water bottles. So all of that can, make a difference. Also, sanitary products are important to consider too. For my patients with endometriosis, I always recommend that they avoid internal sanitary products, both tampons and a cup. We want to allow the uterus to drain that blood effectively and get that flow happening. So when you introduce an foreign body into the vagina, the cervix will constrict. So it just means that it's the uterus and cervix are muscular. So instead of the dilation and allowing for full flow of blood to come out of the uterus and for the uterus to clear, you're more susceptible to congestion of old blood within the uterus and subsequently retrograde menstruation. So pads or period underwear is definitely the way to go if you're experiencing period pain. Also, castor oil massage and lower abdominal massage and castor oil packs on the uterus and ovaries can also be really good for just encouraging blood flow and reducing that swelling and inflammation, and support healing, can break up adhesion, scar tissue. So my top things to consider nutritionally and supplement wise would be diet, avoiding inflammatory foods like for you, which could be gluten or dairy, ensuring that you're eating organic and clean, Supplement wise, definitely zinc is high up there. Fem21's really helpful, and you can adjust that dose around your period and before your period, so you're having extra support. DIM or diindolylmethylene is another really great supplement. Iodine too can be really helpful for estrogen metabolism, and turmeric, other anti-inflammatory herbs are also really beneficial too. So good luck. I hope you found this helpful in supporting endo. Thanks, bye.